he is looking for the dysfunctional pattern that is pain-free. That's one of his big kind of principles. Let's go back and see how he kind of progresses this one. All right, so now he's given her a kettlebell. Staggered stance. Kettlebell is in her right hand. Her right leg is back. Her left leg is forward. Band around the thighs still. Gotcha. So basically, right, so she's doing the kickstand again. She's holding that weight forward in her right hand with her opposite left foot forward, and that back foot is lifting up. So she's having to control her weight over her front left foot and leg. She's got her shin pretty straight up. But the reason he's asking her to control is she's lifting that foot up and banging it back down because she doesn't want to shift all of her weight forward. So he's really asking her to kind of single leg single leg stance onto that front leg.
Good. Now hold it. We're going to go a little more towards the
So this is the capacity thing. This is the threshold. She said she's on fire. She's already surpassing an old threshold. If you feel like your muscles are on fire, that is new threshold level. And then he's like, cool, now we got a little bit more. Let's push this. Okay, so now, I think we missed this part. He is having her kind of bend her back knee down. She's doing a single leg squat. She's doing a single leg lunge, right? But she's hinging a bit more. She's still hinging. She's making less a squat, but more of a hinge. So her torso is way forward. The weight in her right hand is pretty equal with her front foot. And he's basically having her just lunge, deadlift forward. Really should have her glutes on just absolute fire right now. Oh, she's complaining.
Stand tall and walk into staggered stance, leaning forward like a deadlift.
There you go.
Leaning forward. Good. And kickstand. Good. Now, slow it down and make it so you have control. It's all the weight is already on your right leg even. Yeah, breathe behind it.
Okay, so here's another one. Breathe behind it. You've probably heard Charlie Weingroff talk about breathe behind the shield. And some of my favorite guys this week. Gosh, what's his name? Mike on PRI. Mike. God, I can't remember his last name right now.
Kentrell.
Yep, was talking about how magical breathing when your body is in an optimal position. So basically, there is this idea: breathe behind the shield. Now breathe and own it, right? If you don't, they'll say if you don't own a position, you can't breathe behind it, right? And so once you get there, usually people will start to hold their breath in these really tight positions. And this is switching back from training to rehab, right? You know, if you're doing those big three, the breathing is pretty straightforward. You breathe, you brace, and then you move the weight. Here, he's asking her to control her breath while she's got this on fire, her glutes on fire, so that it further integrates kind of into the system. Let's go back here.
And now go down towards the ankle.
Okay, so now she's
making sure you're shoving your butt back. So less of a squat and more of a hinge. That's it. Now freeze. Get that knee over your ankle.
Okay, so here's one I wanted to show you. Okay, so she goes and does that single leg hinge squat situation. She's a lunge with a deadlift hinge. However, her shin goes way back on this second one, on this right side. I don't know exactly why, but this does happen quite a bit. That means she's still kind of back on that other hip. She hasn't been able to come forward onto that front hip. So again, he's coaching her super intently, but he's just trying to make it symmetrical from side to side. There's really nothing other than that, I think, to think about.
Now when you go down, this is the action. So the butt's really stretching back. Now we have even more tension. Feel that? Hold it towards the ankle and now kickstand.
Okay, so now she's hinging, a single legging deadlift way forward. Her torso is way, way, way forward, like the beginning of a deadlift. And now she's hinging in a more, she's kickstanding in a more hinged position.
Those are the progressions. Crazy?
She's definitely a good sport. I'm not sure how many my patients would endure that one.
That was a long one. I mean, that was a 2-minute video. We stopped it a bunch of times, but that was 2 minutes of pretty much fire. She's like, I don't want to be your patient ever, a tutorial ever again. It's brutal. But I mean, look, that's 2 minutes and her body's demands and capacities were absolutely taxed,
Mm-hmm.
you know? And so you can very quickly show where some of these deficiencies are. I think that's one of the big things, that if you do have this amount of time, that's why I kind of had beef with patients that had gone to see PTs, and people would leave and they'd be like, I could probably do that on my own again. You know, if you're hands-on with somebody like that, I feel like you have a responsibility to work them a little bit, you know, instead of the mindless 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Man, Craig is all there. He is coaching her whole way through, and it's just 2 minutes. It's a long one, yes, but he's focused and dialed in for 2 minutes and just making her absolutely work.
Yeah, he is demonstrating that he's a bit of a linchpin too, because like you said, if they come in to see you and you are exercise-based clinician, but you're just giving them the bird dog and
What do you mean by linchpin?
Yeah, linchpin. Linchpin is like the pin that's on a wagon that would hold. It's like one bolt that would hold a wagon to like a horse, or something like that. Or in other words, if you don't have that linchpin, the whole thing falls apart. So, there's a book called Linchpin by Seth Godin. I highly recommend it. But yeah, in other words, I'm saying he is showing that he's necessary. So, like you said, if a patient goes away saying like I could do that on my own, you are becoming kind of dispensable in a way. So it could be, that's a little bit more semantics for your business and for patient retention. But I mean, not only is he necessary so that she does it correctly, but he's necessary because the demand is there for somebody to kind of coach this. I did have one thing before I forget, which is I like the addition of the weight, because I think it made it hard. Obviously, it made it harder for her because there's more like frontal and torsional plane demands by holding the weight, but it's puts you in a better position naturally. It's like a self-limiting move by adding that weight, because it just, then it automatically creates like her turning back towards the front leg more naturally, because that weight's going to be holding her there. You know what I mean? In a good position naturally, but it's going to make the exercise harder.
Absolutely. Yeah, I mean, and she has a really good job of kind of keeping her torso still and like not really rotating too well. She's clearly an athlete at some point.
Yeah, and right here, she either just lost focus of where she's supposed to be, or maybe the right hip is burning a lot worse than the left, so she just had to shift away, until he made her go back to where she's supposed to be.
Right. Well, I mean, yeah, she's taxed, man. She is on fire there for sure. You're going to lose your position once you get taxed, and then having the body go back into it, man, there's a lot of learning basically that's happening in that position without him. He's saying a lot. I was going to say without him saying a lot. He is saying a lot, obviously, but her body is learning far more than the couple words that she's saying, if that makes any sense. Like, especially if you're talking about like, we've talked about the sensation stuff with like the Theraguns and the cupping and the manual therapy. Like, the one thing that I guarantee they're all doing, even if it's an E-stem, there is a sensation created in an area, passively, endogenously, exogenously, from the outside, from the inside, passively or actively. And so you had a good little post actually this week. You were talking about empowering the patients. Like, I know that he talks about this quite a bit. So like at the very end of that exercise, he was like, this is your progression. This is it. This is the thing you need to do. So he's taught this to her, and very likely that's her home exercise program. Right. And so he's created this little kind of feeling, the burning sensation that she just got. And so she's now got a new baseline for what that should feel like. You know what I mean? How many times, if you're a clinician, you ask a patient about their exercise, their clams, their glute bridges, and you're like, how are those exercises going? They're like, good. I did them, is the general response. Versus, do you feel you have more capacity with those things I gave you last time? Right. So I imagine if this was me, this is what I would assume. She's going to go home with that exercise: monster walk to the side, kickstand out, bend and do a little hinging in that kickstand place, feel those glutes burning and engaging, monster walk back the other way, do the same thing on the other leg, right? and she is to increase her capacity within those movements, that process of movements, basically.
Yeah. Yeah. As I'm watching his videos in a row too, I'm also thinking about this idea where patients just need, I think so many people, and I'm not talking about athletes, but I'm talking about people that maybe used to be athletes or never were athletes, where we're just, unless there's some, I don't know, some spark or reason for you, you don't ever have to push yourself past any kind of threshold.
Right.
Do you know what I mean?
Mm-hmm.
Your new normal is, yeah, I mean, I walked for 5K. That was a long walk, but you could have no, kind of feeling like this lady does, this woman, as far as, wow, that's what lactic acid feels like, or that's what this burning feels like, or that's what my heart rate, I've never had my heart rate up above, 120 in,
Right.
15 years.
Yeah.
And I think, at first, if you all of a sudden smash your body and you're not used to it, you can almost feel a little sick, kind of feel like messed up, like woozy, kind of want to sit down, you don't feel good, maybe you're not even hungry for a couple hours. That is a sign that you are deconditioned to any kind of lactate threshold. Any kind of VO2 max is just terrible. But once you get past that, you can kind of get this euphoric, like you can feel how good this can be for you to push yourself past a threshold. That doesn't mean like zone 1, zone 2 stuff is, I mean, that's actually where you should spend most of your time, it seems these days. But what I'm just kind of saying, if you don't, if you never sprint, for example, then you never get that feeling of what it's like to push your body hard and fast. If you're only, a zone 1 runner, when you lift, you do it more, old school Olympic lifting style, which is you do a single and then you sit down for 5 minutes and eat a donut, and you go do another single, and you go talk to people for a while and go do another single. Yeah. That can become your new normal, or no exercise at all. So, I mean, this is what I've watched Dr. Liebenson stuff for years, and I have his book on my shelf, but as I'm just trying to think of something new here, this is just an idea that's kind of permeating through me right now. This idea of, especially in the rehab setting, we can be just too controlled and too slow and too not timid. I mean, you don't want to hurt a disc when they have a disc herniation, but pushing a person to grow, it's not always through just the reps, and, it also can be through other systemic things in your body, like metabolic system, cardiovascular, lymphatic, sweating, all the heat, blood flow, all that stuff.
Right. No, I agree. And I think especially in the musculoskeletal world, this happens. And sometimes for new doctors, it can be frustrating. Hey, my back is killing me. Help me. Okay. How bad does it hurt right now? Well, right now it's about a 2. But, when I wake up, it's really bad. Or at the end of the day, after I sit for a long time, I get up, I can't get back up. But right now, it's not that bad, actually. You know what I mean? And so you're like, okay, so I'm going to work on your back. I'm going to adjust your SI. I give you a hip stretch. And so if your pain is at a 2 and you come in to see me and you leave and your pain is at a 1, I cut your pain down by 50%. How much of a difference of feeling is that to the patient? You know what I mean? They're like, I'm not really sure what happened there. He definitely did. I heard a pop, or, I definitely feel beat up from the work I did. But so I'm saying in these situations when the chronic pain patient is super low, and they go through something like this sidestep series where they get this, what Bobby's talking about, this high metabolic return, they're feeling something. They're feeling that you made a change. This is definitely a time when you can kind of work some of this stuff in, right? You can really make an impact to the system over just kind of their one painful spot. I know Dr. Liebenson is big on the Carol Lewitt, he who treats the side of pain is lost. And so
I say, yeah, I think it can be a little bit like when you dial in your nutrition after eating terribly for a long time, you kind of forgot what it can feel like to feel good. I'm sure you've done this too, but I've had those periods where, like a couple of years ago when I was traveling the globe, I wasn't really doing any training. I was off work, just traveling. And and there's been a few other periods from injuries and things like that where I haven't done a lot of legs. And then you come back and you start strength training legs quite hard. And it's not like just in the gym as I'm putting the weights on where, oh yeah, I'm stronger. It's just like walking around town where I'm like this, I feel better just in locomotion period, or in stance, or in anything. And
Right.
it's like when you switch your diet and you make, whoa, okay, I didn't know what it feels like to feel this good, or not to crash every day at 1 o'clock and need 3 Red Bulls. So I feel like, again, part of this, like use that example of the 2 out of 10, they will notice something like that though. If their
Right.
function and their capacity increases, that could be enough to just numb out something like a 1 or a 2 out of 10.
Absolutely. Yes. And so I think I can't speak for all the patients he's treating, but I feel like that's a good way. I mean, if someone's really, really hurting, I mean, I've seen some of his little case studies where he treats, and this is one of the critiques I think of him. He treats, and on his page, there's such a variety of different things that he's doing that it's kind of hard to keep up. But he's definitely I feel that like he's trying to find that window into it and kind of go from there. Okay, so let's find another way.
I have a question for you though.
Yeah.
Do you think that his plethora of different exercises is because he's being that specific, or do you think he's actually being quite general, and in the moment he's a bit like an abstract painter? He's just kind of saying, well, they need more hip stability and strength, and they need more frontal plane control, and they're a little bit deconditioned, so I'm going to put this little circuit together that'll kind of address all that. Because in that way, that's a bit general. It's, in that case, it didn't have to be this kickstand exercise. That's kind of arbitrary. You just needed that certain stressor. So do you think he's actually trying to be that specific with every person he sees, or it's a bit like, some Jackson Pollock stuff going on there?
I think two things. I do think that he has been around long enough where he can start to wing one of those exercises and find kind of the flaws and kind of fix them naturally. Some of those dysfunctions will pop out in an activity like the one we just saw. And so he can kind of, improvise. He can be Charlie Davis and jazz and kind of make it work. But I do know that maybe we probably should have gone through some of these posts. Maybe I'll pull one up where he calls it his audit. He'll do his specific audit, then he'll do his little movement audit, and then he'll go back and retest. And so we don't have one of those videos. I could pull up one of those videos. So yes and no. I think he's got a general idea. I can't speak for him exactly. I've seen him very specifically do an activity and then go back to a test, and the patient goes, "Oh, wow, that's a lot easier." There's one test. I mean, he does one of the tests that you were talking about, like a single leg squat. He has a guy sitting down on a bench with a single leg, testing left versus right. And let's pull it up. Let's just pull it
Maybe
up.
we just need to get him on the podcast so he can answer that question.
I mean, I
us.
think that's perhaps the best thing to do about this.
Should I just read from Infinite Jest while you're finding it?
Right.